Hello, ladies and gentlemen. I hope you're all doing good. And I am a chronic prostatitis survivor. Basically, we'll be talking about what chronic prostatitis is, what are the symptoms, how you can treat this condition, how you can basically attack this condition because I have been dealing with chronic prostatitis for the past 3 years, and I know people who are having chronic prostatitis for the past 20 years, more than 20 years. So, chronic prostatitis is a very difficult condition to understand. It's something that you cannot completely cure or treat. Any doctor who finds the solution to it, I think he or she will get the Nobel Prize, and I don't know why they're not finding a solution to it because medical science and a lot of literature on this topic is not very authentic or not very well researched. I would say authentic is something I wouldn't like to use it. It's not very well researched, and because chronic prostatitis continuously changes its phases, changes the conditions and everything. So it's really difficult for people to understand why chronic prostatitis occurs, how it starts, why it stops. Uh, there are different classifications to chronic prostatitis. The number one is bacterial prostatitis, abacterial prostatitis, and there are different classifications to it. And if you're on this video, you must have searched about all of these classifications. We have the bacterial prostatitis, in which you can have some bacteria in your prostate. You have the abacterial prostatitis, which is also known as chronic prostatitis, chronic pelvic pain syndrome. You can name it anything that you want to, but uh, I myself have been dealing with this condition for the past 3 years. I was a happy man. I was really happy in my life. I completed my studies and my degree, and I was enjoying. And one fine morning, I woke up. I went to the washroom. Then I came back. I had this uh, very, I would say, excruciating pain on the left side of my abdomen, on the lower abdomen, and on the other day, the same thing happened to me again after a few days. Chronic prostatitis. It took me years to understand what the situation is, how we're going to treat it, and one thing that I've understood in my life is that there's no cure to it, there's no solution to it. All you can do is that you can basically suppress this condition. You can basically avoid this condition by certain things. So right now, I don't want to prolong this video because I have a lot of literature, I have a lot of knowledge on this topic. It's a very hot topic, I would say, and a lot of people are coming on YouTube and they're searching, and I thought that maybe I can also put my share and help some people out there. So I'm making this video from my phone. I don't have proper setup. I don't want to do any editing or something like that because it's not a fancy video. It's something anyone who's suffering from this condition, I can understand your pain and agony, and I'm with you in this pain, and I wish you all the best luck. And I'm telling you that there are good days and there are some bad days. So if you're having a bad day, inshallah, I'm very hopeful to God, I'm very hopeful to Allah that this condition will go away and you will be as good as a horse. So now coming back to these three medications that we have right now in front of us. Uh, I'll be talking about the supplementations, the diet, and everything, but right now, just think that you are in pain and you want to treat this condition. So, there is an approach in allopathy as well, there is an approach in homeopathy as well, there is an approach in supplementations. We'll be going in detail as time passes by. Right now, you're in pain, and what you want to do. So, I'm not a medical practitioner, and I'm not advising you to take all of these medications. You can take if you want to. I have been taking these medications and they did wonders for me. It really helped me in passing those difficult times in which I was sometimes crying, in which sometimes I was in a lot of pain. So the first medication is Arnica 200, as you can see over here. uh, it's a really potent medication. It's a really potent painkiller. It's used after surgeries most of the time. Homeopaths use it for all of those people who are going from any kind of inflammation, joint pain, arthritis, and pains that you cannot understand. Arnica 200, you can basically take 3 to 5 drops on your tongue directly, and with a duration of like 6 to 8 hours. You can repeat it like 3 to 4 times in a day, 6 hours or 8 hours, 8 hours 3 times, 6 hours 4 times. It will really help you in this pain. Then we have this Merc iode rub basically, and this homeopathy medication is also used for pain, inflammation, and it's specifically used for penile pain, for uh, pain which is basically at the tip of your penis or at the base of your penis. So you can also take this medication. Now you have to take these two medications in combo. So 3 drops, 6 hours, okay, 4 times a day. And then we have this really good medication, sarsaparilla 30, and you have to take both of these medications in a combination. So what you have to do is that you have to take sarsaparilla, then you have to wait for like 10 minutes, and then you can take this Merc eye drop. And these two medication will also help you a lot. And we can also take Arnica. Arnica is a really good medication. Arnica 200 really helped me in my bad days. It helps you basically. So these medications are basically for pain, and let's see what happens if you want to take them. Disclaimer: I'm not a medical practitioner, I'm not a homeopath, so please take it on your own risk. But it has worked for me. It did wonders for me when I was in a lot of pain, because in chronic prostatitis the problem is that when there's pain and you have to just control that pain, you have to get out of that pain. We are not treating the situation. We'll come back to those, all of those things, and how we can treat and what's the treatment and everything. But the main problem with chronic prostatitis is pain. Pain is the main problem that basically shuts you down. So when you basically get out of that pain, after that pain you can think clearly what you need to do. So right now, take these medications, Arnica or Merc a drug or sarsaparilla 30 in a combo, and just let me know in the comments that how are you feeling after that. Thank you very much and have a great day.